All new at 5:30, Florida is experiencing a shortage of nurses, and it's only expected to deepen as more people move to the state.
It is top of mind for UCF's nursing program. Leaders just announced plans for a new facility, and it could go a long way toward meeting the state's needs when it comes to nurses.
Anchor Justin Warmoth joins us now. Justin, the dean says they've just outgrown their current space, huh?
Yeah, Matt. She says that they are just bursting at the seams right now. And UCF already graduates more registered nurses than any other institution in the state university system. And 85% live and work in Florida upon graduation, which is great. With this new building, though, even more will enter the workforce, and it couldn't come at a more needed time.
Three, two, one.
UCF leaders breaking ground on a new building with a major purpose. The $68 million Dr. Phillips Nursing Pavilion, adding to the school's footprint in Lake Nona's growing medical city.
Lake Nona is known for health, it's known for innovation. We're in close proximity with the College of Medicine, so we'll be able to do much more interprofessional education and interprofessional research. So all of those things make it an exciting location.
An exciting location made possible by a combination of public and private dollars, including nearly $44 million from the state.
Every one of you has encountered a nurse at some point.
Mary Lou Soul has been the dean of UCF's nursing school for the last 9 years.
This has been a quick 18-month journey, Justin, and we got our funds from the state in the fiscal year 23. So since that time, we did an aggressive fundraising campaign, and we're so excited that our community stepped up to help us match the state funding to get us to this space.
And while the 90,000 square foot facility has been a priority for UCF for years, it comes at a time when Florida is facing a critical shortage of nurses. UCF President Dr. Alexander Cartwright.
This region is growing so rapidly. We already have a shortage. If we're not proactive about really producing the talent that's needed to actually provide the workforce, we're going to end up just getting more and more of a deficit.
The numbers are just staggering. Florida is projected to have a shortage of more than 37,000 registered nurses, RNs, by 2035. To avoid that, an additional 2,300 are needed to enter the workforce every year. And UCF says this new building will be crucial for hitting that mark. Can you talk about the importance of, once nurses graduate from the program, that they stay here in this growing community?
Right. What's really great about our student body is that 85% of them stay in Florida upon graduation, and 60% stay right here in Central Florida. So we really are helping to fuel that future of nursing and healthcare by increasing enrollment.
With the new high-tech facility, UCF predicts an additional 150 nurses will graduate each year on top of the roughly 260 it averages now. And Dean Soul says they'll be even more prepared when they enter the workforce.
We're increasing our simulation space threefold, which will allow us to have really creative, innovative simulation to teach that next generation, because you have to have those critical thinking and other skills, and simulation is the way to go.
And construction on the new facility is expected to take around 18 months, so UCF hopes it'll be ready for the start of the 2025-26 school year.
Wow, that is fantastic. And as you've mentioned, the need is so great, not just here, but really around the world, really.
Right. I mean, the pandemic really exacerbated this problem.
Yeah.
And a lot of nurses, registered nurses included, left the profession. They were burnt out after the pandemic.
But it's great that so many people can just come out of college and go right into a very high-paying, high-demand job.
We need, there's a lot of jobs we can run out of, you know, politicians, news anchors.
Yeah.
I mean, to tell you how important this is, Advent Health and Orlando Health, competing hospitals, both donated to this new facility. So the need is there.
Yeah.
Hospitals recognize it, and they're trying to do what they can.
You don't see that happen.
We could change the name of a nurse to a saint, by the way.
Absolutely.
That's the truth.
Absolutely.
All right. Justin, thank you so much.